Hello everyone, I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Basveshwanagar, Banglore. I would like to uh, enlighten my patients or who are watching this video about what Divisha Arthritis and Medical Center is about, what a rheumatologist is about, and what are autoimmune disease about. So, to start with, first I would like to let you know about what is autoimmunity. Autoimmunity is immune system in the blood which is supposed to protect us. They are like our defense forces. So that is actually meant to protect us from all external attack and external attack, and then uh, giving us protection from infections and also protection from various diseases. But in autoimmune diseases, the immune cells become our enemy and start attacking us. It's like Indian soldiers attacking India. So it can affect various organs of the body, not only joints. It can affect brain, eyes, hair, skin, glands, lungs, heart, and then bones, joints, blood, and kidney. So this we categorize into mild, moderate, and severe. If skin and joints, skin and hair only affected, it's categorized as mild. Skin, joints, blood are affected, we categorize as moderate, and if it's internal organs such as lungs, kidney, and brain are affected, we categorize as severe. So there are several autoimmune diseases, of which commonest is rheumatoid arthritis. Then there is SLE or lupus. Then there is vasculitis. Then there is ankylosing spondylitis. Then there is psoriatic arthritis, and there is several other of them. It affects various age groups, from uh, youngest patient being children or adolescents, and oldest patients being above 65 years. So the myth that arthritis affects only aged people is actually wrong. Most of the autoimmune diseases affect between the age of 15 to 45 years age group. So it affects both genders, males and females, although rheumatoid arthritis is more common in females and ankylosing spondylitis is more common in males. It can affect even kids. So, youngest patient can be as young as even 5 years to 7 years, or between even adolescents between 18 to 20 years. So, the myth about that only certain sections or gender can affect it is actually wrong. It can affect even pregnant women. One of the most common causes of pregnancy loss can be autoimmune diseases. So, who treats autoimmune diseases? It's a rheumatologist who treats, who has a special super specialty training in treating autoimmune diseases. After doing MBBS, we spend around 3 to 4 years in general internal medicine, and then another 4 to 5 years in rheumatology with treating autoimmune rheumatic diseases, and subspecialty like what I have done in United Kingdom, where treating certain sections of autoimmune disease like lupus. I have special interest in lupus and rheumatic diseases in pregnancy. So, autoimmune diseases are better treated by rheumatologists because we not only have in-depth knowledge of immune system, we also have knowledge about side effects of these medicines, how to manage with complications of these diseases, and so on and so forth. Now, to let you know about myself, I am Dr. Vijay Rao. I graduated from Bangalore Medical College. Then I went to United Kingdom to do my internship and further general internal medicine, where I rotated through various branches of medicine and selected rheumatology because it affects several organs of the body, and most of these diseases, if not treated well, can lead to devastating complications in main bread earners of the family. So I worked with one of the world-renowned professors in rheumatology, such as Professor Paul Emery in Leeds and Professor Caroline Gordon in Birmingham, who is one of the world authorities in lupus and runs the Lupus Center of Excellence in Birmingham. and also Professor Simon Bowman, who is one of the leads in Sjogren's syndrome, which is one of the autoimmune diseases. So these are the centers where some of the cutting edge research have been done and involved in several drug trials and researches, and also contributed to several of the textbook chapters and publications in rheumatology. So after coming back to India, I have been associated with Manipal Hospital for the last 8 years, and Divisha is my own one-stop solution for autoimmune diseases. I've been running for the last 4 years. Now I'm a full-time consultant here, where we are open from morning 9 a.m. till evening 9 p.m. Monday to Saturday. We have a dedicated rheumatologist, which is me, full-time running here, seeing autoimmune diseases, and we have a phlebotomy service where we do all autoimmune service tests, and we have a dedicated pharmacy where we subsidize treatments, because most of these treatments are lifelong, including some of the costly expensive medicines such as biological agents. We offer more than 50% discount to patients. And we have a dedicated daycare service for running injections such as monoclonal antibodies, cyclophosphamide, endoxan, solimedrol infusions, and with a dedicated, fully experienced rheumatology nurse. And we have physiotherapy for all our autoimmune diseases, for muscle strengthening, stretching, and therapeutic yoga services also. This is one-stop solution for making all autoimmune disease patients better. So, having told about autoimmune diseases, having told about rheumatologist, having told about myself, what I would like to tell is autoimmune diseases are definitely can be controlled with early diagnosis. Correct treatment, lifelong treatment may not be required if treated early within 45 days of window period. So most of these diseases can be totally controlled within 3 months, and 3 to 6 months we stabilize the treatment, and from six months onwards we gradually start reducing the treatment. And once we reduce the treatment, we see patient to patient improvement, and if patient is doing very well, then we slowly reduce the treatment and gradually stop it. Now, if after reducing treatment disease gets worse, then of course we do not stop the treatment, we maintain it at a very low dose. All these treatments are extremely safe, they do not cause any side effects, and we don't rely on steroids as rheumatologists. We use several steroid sparing agents, and we don't use heavy painkillers. These treatments are safe in pregnancy and can be used very well in pregnancy without causing any side effects to baby or mother. With that in background, I would like to tell and conclude this video by telling that most rheumatological diseases get better only if you have faith. So you have to have faith in yourself, faith in the doctor you're seeing, and faith in God. So I often tell this to patients that it's a teamwork, with the main player being the patient and the supporting player being the doctor, that is me, and the umpire being the God or faith. So with that statement, I would like to say that you would do very well with all your autoimmune diseases if you take timely treatment without any major side effects, and hopefully you'll get cured from all your diseases. Thank you very much. God bless you. Hello everyone. I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Basveshwanagar, Banglore. Today I am going to talk to you about autoimmune disease which affects more commonly in males between the age of 15 to 45 years, or even younger or older than that. Affects more on one side of the body, affecting 2 to 4 joints, and most commonly affects spine or hip joints and lower limbs. So it's called ankylosing spondylitis or inflammatory spondyloarthropathy or spondyloarthritis. There are many names for that. So in this, common thing is this is an inflammatory disease where patients have pain, swelling, stiffness first thing in the morning, which gets worse with rest and better with activity, better with painkillers, and causes swelling in the joints. Um, and as shown in the slide, it affects one joint on one side of the body. That in this slide you see there's one wrist and one knee, one ankle, and one toe, and more than 6 weeks of duration, and collectively it's called seronegative spondyloarthritis, as shown in this umbrella diagram, where you see that there is axial manifestations affecting spine called axial spondyloarthritis, and when seen on the X-ray it's called radiographic axial spondyloarthritis, and when not seen on X-ray and seen only on MRI it's called non-radiographic axial spondyloarthritis. If seen after infections such as or any loose motions such as gastroinfections or gastroenteritis, or any genitourinary infections such as urine infections or sexually transmitted diseases, it's called reactive arthritis. If seen in teenage and adolescents, it's called juvenile ankylosing spondylitis. And if seen in inflammatory bowel disease such as Crohn's disease or ulcerative colitis, where it causes extreme mouth ulcers, weight loss, anemia, lack of absorption, loose motions, nighttime loose motions, severe abdominal pain, then it's called inflammatory bowel disease or enteropathic arthritis. And if associated with psoriasis, which is scaly skin patches, silvery white patches, which is commonly hereditary or genetic, affecting various parts of the body and nails and causing dandruff, then it's called psoriatic spondyloarthritis, causing hip or joint pain or spine pain or feet pain, or sausage shaped toes called dactylitis. And if none of these are associated, it's called undifferentiated ankylosing spondylitis. So, in this, patients have many manifestations such as inflammatory back pain, they have arthritis, they have heel pain or called plantar fasciitis, they have uveitis, where there's one structure in the eye called uvea which regulates the flow of the light into the back of the eyes. So this uvea is in the center of the eye behind the lens, and it regulates the shape of the lens, so that kind of lets the light in. So that tissue resembles the joint in genetic makeup and can affect inflamed red eyes, painful swollen eyes, where you have to rush to the doctor to get drops. It happens in about 30% of the patients with ankylosing spondylitis, and in 30% of the cases it can be recurrent, that is happening again and again and affecting both eyes. It can also cause psoriasis, which I just told, and it can cause dactylitis, where sausage shaped toes or fingers, and usually there will be family person having this problem. If not, it's genetic and only you can be having that problem. And patients often have this gene defect called HLA-B27, which we do normally in a blood test, and inflammatory markers are elevated or high in 40% of patients. That is, 60% of patients might have normal ESR and CRP, but doesn't exclude this disease. So with these symptoms, you can have on examination such as shown swollen knee here or swollen Achilles tendon, which is the back of the heel, that is this place, the back of the heel, the ankle. And patients often have a stooped posture, that is in the frame of question mark when it is severe, and the back might become straight and the neck might become bent, as shown in this picture, and the legs may not be straight, as shown in this picture. And in lab tests we see that raised ESR, CRP and hemoglobin might be low, and in X-ray we see that the sacroiliac joint, where you see that this part of this bone, that is the buttock bone, gets affected or inflamed and causing buttock pain, which is worse in the first thing in the morning, and gets better with movement. So the X-ray takes 2 to 3 years for the changes to develop. If within 6 weeks or 6 months, then better to go for MRI. So in this X-ray we see that there's both sides inflamed called sacroiliitis. It takes about 2 years for that to develop, and you can also see something called as squaring sign, or the spine becomes square shaped, and you see something called as syndesmophytes formation at the edges of the spine as shown in the picture. And in late stages the spine gets fused, and bending, forward bending or side bending might be difficult. The worry part is if this hip joint gets affected, then the ball of this hip gets affected, and the movement of the hip, that is the above movement and also the side movement, gets affected, and that's as shown in this X-ray picture. It can lead to hip joint erosions leading to hip deformities and hip replacements in a very young age. So in order to prevent hip replacements, this disease has to be picked up early by seeing a rheumatologist, doing the relevant blood test, doing the X-rays, and starting off the treatment early on. That's very, very important. In case of early stages within 6 months, it's better to go for MRI, which is shown that in the X-ray it is come back normal, but in the MRI it's showing what we call as inflamed white sign or hyperintensity seen on stir sequence. It's called bone marrow edema or osteitis. So treatment is painkillers, which is very helpful, which you call as painkillers, we call as anti-inflammatories, which we give in all stages of disease, early stages, late stages. We might have to give even bit long term, without causing much side effects in the initial stage. But painkiller dependence, if it is severe, that is needing more than 3 times a week, then we think of what we call as biological agents, which are monoclonal antibodies, injections, which completely resolves the inflammation on the MRI and puts you back to full work or full life within about a month or 6 weeks time. But these have to be taken at least for 6 months to 1 year, and they might cost you around 18 to 20,000 a month, and sometimes a bit more expensive. But in this clinic we give heavily subsidized thing to the patient so that full recovery happens. So these injections are very safe if adequate safety checks are done, and we also give tablets such as sulfasalazine or SAS initially, and if not responding, then of course injections. These days JAK inhibitors or tofacitinib have revolutionized treatment, and they are used initially with sulfasalazine as a combination and painkillers as and when required. And biological patients or those who don't respond, in about 50% of cases we use these biological injections, with which nearly 95 to 100% of patients respond. Physiotherapy is very key. So in this slide you see that those with before treatment in the MRI with etanercept or one of the biological agents, complete recovery within 6 months of treatment. This is with adalimumab treatment in this slide, where at 3 months partial recovery and 6 months full recovery. So with treatment you also need physiotherapy. Stretching exercises or swimming is very important with this, and with adequate physiotherapy and treatment you can lead a normal life and achieve whatever you want to. Thank you very much.